So for our health education teaching demonstration, we chose to do alcoholism. So our 3 lesson objectives that we are choosing to focus on are how one can seek help when struggling with alcoholism, the signs and symptoms of a person struggling with alcoholism, and how to avoid overdoing it with alcohol and maintain a healthy lifestyle. So before we get into the lessons, what exactly is alcoholism? So according to MNT, a registered trademark of the Healthline Media, alcoholism, now known as alcohol use disorder, is a condition in which a person has a desire or physical need to consume alcohol even though it has a negative impact on their life. So somebody that struggles with this is known as an alcoholic. These are just some facts and statistics about alcohol. So 85.6% of people ages 18 and older reported that they drank alcohol at some point in their life. And each year, there's 1,072 vehicle crashes because of alcoholism, 1,000 homicides, 208 alcohol overdoses, falls, burns, or drownings, and 596 suicides. And this is just each year in the United States. So this is definitely a problem that is going on right now. So for our first lesson, how can one seek help when struggling with alcoholism? I just started out with a quote, which is, alcohol-related problems which result from drinking too much, too fast, or too often are among the most significant public health issues in the United States. So this is probably one of the biggest public health issues that you can think of. Ultimately, there's not one great option for seeking treatment. It really just depends on the person and the situation that they're in. But there's 12-step programs, the 28-day inpatient rehab. There's certain medications that you can take that can help with it. That has to be prescribed by your physician, though. There's mutual support groups, and I put here the Alcoholics Anonymous group, which is probably the most popular one. And you have to really learn how to cope and avoid the triggers that can cause for a relapse. You have to surround yourself, with people that aren't around that. And that's why these support groups work for those people. And there's also counseling as well. So our second lesson is, what are the signs and symptoms of a person struggling with alcoholism? So one of the biggest ones is drinking alone or secretly. Usually when someone just drinks recreationally, you see it more when they're with people. But when they're an alcoholic, they're usually alone. They lose interest in hobbies that have previously been a big part of their lives. They feel that constant urge to drink every single day, like they can't live without it. They gulp down drinks in order to take pain away or to feel good. They dealing with nausea, sweating, or shaking when not consuming the alcohol, blacking out and not remembering certain times. And alcohol consumption becomes a problem when it takes over one's life, and no other activities are important. So dependence on this can take several years, but it's definitely something that you have to keep watch for because it can happen fast as well. So our third lesson is, how can one avoid overdoing it with alcohol and maintain a healthy lifestyle? I have it listed here that drinking slowly when you are drinking, usually when you start chugging or you start gulping down that alcohol, that is when it becomes a problem because you get drunk very fast. You want to keep going, and that's when it can become a problem. So drinking slowly, you pace yourself, it's not as much as a problem. Staying busy with work, school, exercising, going out to eat with friends, or any other hobby that interests that certain person. I think a big one here is the watching for peer pressure. Peer pressure is a big deal. I think that's when people start to, whenever they don't actually want to, but then they get that peer pressure, that's when it becomes a problem. Journaling, setting life goals, thinking of dreams to fulfill, meditate, and have a well-rounded diet. This can all contribute to a healthy lifestyle and avoiding overdoing it with alcohol. So that is all for the lessons, but some of the risks of alcoholism, it increases the risk of injury or even being killed in an accident situation. There's a lot of health problems associated with it: high blood pressure, interference of brain communication pathways, and liver inflammation diseases or even cancer. It weakens your immune system, mental health disorders, depression, anxiety, schizophrenia, learning and memory disorders, and alcohol poisoning. Alcohol poisoning is a big one. Whenever you consume too much, you go to the hospital, you have to get your stomach pumped. It's a big deal. So we assessment questions. So number 1 is true or false. There's only one good type of treatment for a person struggling with alcoholism. Number 2 is which one is not a risk factor of alcoholism? A, liver inflammation diseases, B, mental health disorders, C, losing vision to the point of blindness, or D, learning and memory disorders. 3 is what is one way you can avoid overdoing it with alcohol? Number 4 is true or false. A person struggling with alcoholism usually just drinks casually with friends. And then number 5 is approximately how many suicides happen each year because of alcoholism. So our answers are number 1, false. There are many good treatments for alcoholism. Number 2 is C, losing vision to the point of blindness. That is incorrect. 3, drinking slowly and staying busy is a way to avoid overdoing it. 4 is false. Alcoholics usually drink alone or in secret. And number 5 is 596. And that is all we have, and these are our references.